Imagine the very framework of your body, the stuff that literally holds you together, having a hidden flaw, like a tiny misprint in its genetic code. For some people, this isn't just a thought experiment. It's a reality, where their body's biggest blood vessel, the aorta, is at constant risk. Today, we're diving into the world of heritable aortic disease.
So here's how we're going to break it down. We'll start with the basics, the body's hidden framework and what happens when it's not as strong as it should be. We'll look at Marfan syndrome as our classic case, then broaden out to a whole spectrum of similar conditions. After that, we'll get into diagnosis and management, and we'll wrap it all up with why knowing about this stuff is so incredibly powerful.
All right, so to really understand what can go wrong, we first have to appreciate what's supposed to go right. And it all begins with our connective tissue. You can think of connective tissue as the body's all-purpose material. It's the scaffolding, the glue, the shock absorbers, everything, all rolled into one. It's made from these super important proteins like collagen for strength and elastin for stretchiness. This tissue is what gives our blood vessels, especially the massive aorta, the ability to expand and snap back with every single heartbeat, day in and day out.
That is the critical question, right? Because when the genetic blueprint for these essential proteins is off, the entire structure is compromised from day one.
And that genetic flaw leads us straight to the most dangerous problem of all, the weakening of our major arteries. Honestly, the image of a weak spot in a garden hose is just perfect. You've got all this pressure from the blood flowing through, and if there's a structurally weak spot in the aorta, it can start to bulge out, forming an aneurysm. And as it balloons out, the vessel wall gets thinner and thinner, making it dangerously likely to tear or even burst, which is, as you can imagine, a massive medical emergency.
This visual right here gets to the absolute heart of the problem. On the left, you see how healthy elastic fibers are supposed to look. They're strong, organized, flexible. But look at the right. In conditions like Marfan syndrome, it's just a total mess. The fibers are broken up all over the place. It's this chaos on a microscopic level that leads directly to that life-threatening weakness we see on the big scale.
So to really get our heads around this, let's focus on the most well-known of these disorders, Marfan syndrome. Okay, so picture this. It's 1896, and a doctor named Antoine Marfan is describing a young girl with unusually long arms and legs. Now, he didn't know it at the time, but he was looking at the effects of a mutation in one single gene, FBN1. This gene holds the instructions for making a protein called fibrillin-1, which is absolutely essential for building those elastic fibers we just saw. Without good fibrillin-1, the body's connective tissue just doesn't have the strength it needs.
But the story of Marfan syndrome is also this incredible testament to medical progress. I mean, back in the early 70s, a diagnosis basically meant your life was going to be cut tragically short. The average age of death was around 38. But then, things started to change. In 1994, a huge clinical trial proved that simple beta-blocker pills could actually slow down the aorta's dangerous expansion. That, plus major advances in proactive surgery, has totally flipped the script for patients.
And in modern treatment, this is the magic number, 50 millimeters, or 5 centimeters. This is usually the size of the aortic root where surgeons will say, okay, it's time to operate. They don't wait for a disaster. They go in and proactively replace that weakened section of the aorta, preventing it from ever tearing.
But here's the thing. The story doesn't just stop with Marfan. While it might be the classic example, it's actually part of a whole spectrum of related disorders.
Two other big ones you'll hear about are vascular Ehlers-Danlos, or vEDS, and Loeys-Dietz syndrome, or LDS. And while they all share this theme of fragile blood vessels, they're genetically different and come with their own unique risks and physical signs. That's why getting the right diagnosis is just so important.
This table lays out the differences really nicely. For Marfan, like we said, it's the FBN1 gene impacting fibrillin, and the main risk is that aortic root aneurysm. Now, look at vascular Ehlers-Danlos. That's a defect in the COL3A1 gene, which affects collagen. This leads to super thin, fragile skin and a high risk of rupture in medium-sized arteries. Then you have Loeys-Dietz, which is tied to mutations in the TGF-beta signaling pathway, a totally different mechanism. It's known for really aggressive aneurysms all over the body and some distinct facial features like a split uvula.
And that brings us to this quote, which is so important. You just can't treat these conditions with a one-size-fits-all approach. The outlook for someone with Loeys-Dietz is very different from someone with Marfan. The surgical challenges for vEDS, where the tissues are unbelievably fragile, are immense. Getting the diagnosis exactly right is what sets the entire course for a patient's life.
So how do doctors even navigate all this complexity?
Well, let's walk through the journey of getting a diagnosis and the strategies for managing these conditions.
The whole process is really methodical. It always starts with a deep dive into family history. Are there any relatives who had aneurysms or sudden unexplained deaths? Next comes a full physical exam, looking for those telltale signs, like long limbs in Marfan or translucent skin in vEDS. Then they use imaging, like an echocardiogram or CT scan, to actually measure the aorta. And finally, genetic testing can nail down the specific mutation, giving everyone a definitive answer.
Okay, a huge part of management is all about lifestyle. The absolute key is to avoid activities that cause sudden spikes in your blood pressure, what doctors call burst exertions. So think heavy weightlifting, all-out sprinting, stuff like that. That puts a ton of strain on the aortic wall. Instead, doctors will recommend steady aerobic exercises like jogging, biking, or swimming that are great for your heart but don't cause those dangerous pressure surges.
And alongside those lifestyle changes, there's a two-pronged medical approach. First, there are medications like beta blockers and something called ARBs. Both of these help lower the stress on the aorta and have been proven to slow down how fast an aneurysm grows. And second, as we've talked about, is that proactive surgery, the ultimate mechanical fix to replace a weak spot before it ever has a chance to fail.
And this all comes together in our last section, which is really about the incredible, life-changing impact of just knowing, of proactive diagnosis and care.
This chart, wow, it really puts everything into perspective. Just look at the insane difference from Marfan syndrome. Untreated, average age of death, about 38 years old. With modern proactive care, a near normal lifespan. It's just staggering. The chart also shows the serious challenges that remain, with conditions like vEDS, where the median lifespan is still only around 48, which just highlights why more research is so vital.
And that's the bottom line. That's the ultimate takeaway here. Finding out that you or someone in your family has one of these syndromes is, of course, scary. But knowledge is absolutely power. An early diagnosis unlocks the door to monitoring, medication, lifestyle changes, and proactive surgery. All the tools that can turn what was once a near-certain death sentence into a manageable, long-term reality.
And this all leaves us with a pretty fascinating question for the future. We've gotten really good at managing the physical problems from these known genetic flaws. But as genetic testing becomes totally routine, we're going to find countless more little variations and predispositions in our DNA. So the next great challenge won't just be treating diseases we know about. It'll be figuring out how to manage the risks for problems we haven't even seen yet, and turning that raw genetic code into life-saving action.